Right. Okay. So it's a modern day health epidemic that is much worse than people actually assume. The spine has a powerful relationship to your brain, spinal cord, and all of your organs. This intimate connection means that poor posture and spine health will lead to an overall decrease in brain and organ function. So the majority of the population has poor posture and inefficient movement patterns, including me. These are the different types of posture. Ideally, you want a plumb line. Your ear is aligned above your shoulder, is aligned through the trunk, aligned above your hip. This is a hollow back where the thoracic spine is really kyphotic or rounded, and then the lumbar spine is overly lordotic or overly hollowed out. Here's where you have too much posterior pelvic tilt, kind of looks like you have no butt because your back is too flat. Slouch. Military posture is where your chest is heaving up and you're creating too much extension through the thoracic spine. That's not an ideal postural alignment either. Rounded shoulders with the increasing work on computers and working with arms forward, that's just an inevitable thing that happens. And then now with the generations that we have of everyone looking at their cell phones, head is down, shoulders are rounded. You'll see a lot of teenagers now that have terrible posture. And I've treated a good handful of them with nerve symptoms in their hands because of their posture. And so I have the parents bringing them in saying, I need you to help me. My son won't change his posture patterns. From a back view, so the top row is a lateral view. The bottom row is a posterior view. Your spine should be aligned straight up and down. In the side view, it looks like an S. You want a nice cervical lordosis, a nice thoracic kyphosis, and a nice cervical lordosis. From the backside, it's straight up and down. If you have a shoulder injury, a car accident, you can get asymmetries in your shoulders, which will then contribute to creating a spine that's crooked. In this case, this is the starting stages of scoliosis. Also here, with one hip being higher than the other because your pelvis goes out of alignment, this can cause the beginning stages of a pseudo scoliosis, meaning pseudo is kind of fake, it's temporary. But people have genetic scoliosis where it can become pretty severe. And the angulation is very difficult to correct. Sometimes they'll have the bracing methods. Old school, they used to put people in almost like a full body cast with a bracing from the sternum and the chest and in the back. But nowadays, there's a lot of institutes that focus on scoliosis correction. They do like a full protocol where over time, they're trying to change the mechanical structure of the spine. But sadly, most of the people that I see who are very elderly, who have severe scoliosis, have almost permanent damage in their legs because the nerves in the lumbar spine have been compressed for so long. There's a couple of websites in here, and you all can have a copy of this lecture. I have to omit a couple slides. I'm not going to go through all of it, but if you want to see anything in more depth, I'll make sure that you have that resource available to you. So what causes poor posture besides a genetic type of scoliosis? Repetition, your hobbies. I've seen like a cheerleader who keeps twisting over to the left. She had asymmetry due to her repetitive athletic pattern. Poor static postures, just sitting at your desk too long, slouching, just bending over, feeding the pets, rounding your spine without using proper body mechanics. Again, repetition with like rowing or kayaking. Chronically tight hip flexors can then pull on the lumbar spine. Another reason is just straight up, your bed is old and it's sagging. Just having poor, raise your hand if you've ever experienced that. So just poorly designed furniture. So that can be couches and chairs in your living room that are too squishy, too soft, too deep. Inefficient sleeping positions. Some people are very in tune with knowing they need a pillow between their knees when they lie down on their side. Others don't even think about it. And then when I say put a pillow between your knees, they'll be like, oh my gosh, my hips feel so much better. And I'm like, great. But it's, if you can create that intuition on what your body needs, that's ideal. This is very common. Stomach sleepers too. Genetics, as I mentioned, scoliosis or spina bifida. Trauma, car accidents predispose you to having spine disorders in your later years. So you could have had a car accident in your teenage years. You could have worked a very, very highly physical job, like even bartending or bar backing, working in the military. Those kinds of things that can be very compressive will predispose you to having spine damage, falls. Another reason is a lack of interoception. You may have heard me say before the word interoception. The septions are your nerves creating communication with you. Nociception means that you are acknowledging there's pain. Proprioception means that you have acknowledgement of your body's position in space. I know that my arm is up here. Interoception is your body's ability to detect harm or danger. So say you're in a Pilates class and you start doing an exercise that everybody else is doing, and suddenly your body signals, this is going to hurt me, or I'm going to pay for this later. You come out of the posture, you come out of the exercise, and you do something else. That means that you have a heightened interoception. That's what we want. Lack of proprioceptive or kinesthetic awareness. Lack of spine-specific exercises. If you've never done Pilates or yoga or any spine stabilization exercises, then your body is more apt to have compression in those joints. A lot of athletes or weekend warrior type people that I treat have never done this before. All they want to do is lift weights and run and row and kayak and ski, but they've never done pelvic tilt before. They've never engaged their transversus abdominis. And it's like an epiphany. They realize, oh my gosh, you're targeting the exact muscles that are weak in my body, even though I look strong and I feel strong, but I'm in serious pain. Form follows function. If you adopt better postural patterns, static patterns, being still, or dynamic patterns with movement, you're going to do less damage into those joints. So the statistics are 80% of the adult population actually experiences a back pain episode, and 50% of the population has an episode with neck problems. But the good news is that most recover and get better. However, doctors will use these statistics and say, you're going to heal and get better. The problem is if you continue irritating the neck or the back and you don't get proper rehabilitation or guidance or coaching, then your ability to heal from that injury goes down. What's the word I'm looking for? The likelihood, the likelihood of your spine healing from that injury is going to go down if you don't get proper guidance. So it can become recurrent. You can have episodes that happen, and then those episodes can get more severe. I experienced this where I would have my initial severe back episode was in 2004, and it was 2 years after I birthed my second baby. I had really gained a lot of weight, overstretched my muscles to the point where I had a full-blown diastasis recti. My rectus abdominis was split. And so when your abdominal wall is weak, you're going to end up getting more compression in your lower back. So I worked on core exercises from 2002 to 2004, but I worked in a Pilates studio and I picked up a heavy cover off the reformer and I felt a sudden electric shock in my back that went all the way down to my foot. And I knew, great, I just blew a disc and it was L5S1. So that was my first episode. I went through 12 weeks of rehab. I rehabbed myself and I saw practitioners to work on me manually. And then I was fine for like 2 years. But then I had an episode again because I did something stupid. I neglected my workouts. I think I was wearing high heels. I overdid it out in the backyard doing some landscaping and moving rocks. And then I had another episode. And then my episodes came every year to every 6 months to every 3 months. And so that's what happens if you don't just stop and reassess, what am I doing in my life that is not letting my body heal? This can occur at any age, but it's mostly prevalent age 30 to 60. And they can happen due to just being sedentary or being too active. So it's not like it only happens to people who are super active. This is a little infographic that shows you the amount of intradiscal pressure. It's in kilograms, so generally you just double it. But when you lie flat in corpse pose, you have about 50 pounds of force on your L3 disc. This was a research study that was done by EMG, and they measured how much pressure or how many pounds of force were in the L3 disc. And then when you roll over, it goes up to 150 pounds, stand up, it goes to 200 pounds. You bend forward, you do a deadlift, it goes all the way up to 400 pounds of force on your one L3 disc, because he's not a neutral spine and he's not engaging his core. This is just with no awareness and just, doing the movement. Sitting, not good. Slouching and really slouching. So with body mechanics, these are just basic things, but in general, you want to keep your spine in neutral no matter what you do, and use the power of your legs more. You don't want to overflex or hyperextend or hypertwist your spine. You want to maintain neutral, and you want to brace your core abdominals and your lower back. We're going to physically go through these things at the end. For the neck, at 0 degrees of flexion, your head weighs in general 10 to 12 pounds. It's similar to a bowling ball. Once you look down, a 15-degree angulation of flexion increases force in your cervical discs, or increases the weight of your head to 27, and then 40, and 49, and 60. So this is what I'm seeing with most teenagers and young adults looking at their phones all day. When I look at my phone, I elevate it, I change positions. I sometimes will lay on my stomach and let my arms hang down so my neck is in neutral. But it's crazy how much pressure in the spine increases when your head is flexed. And this comes from the National Library of Medicine. Definitely. And then this is just, what's that?
Is it definitely. And also, as somebody that works, I'm a white collar worker sitting on the laptop all day long, I noticed there's been times when I have had my laptop too low, and I can feel that, after a few days or whatever, I'm feeling that in the back of my neck. And, it doesn't feel good. And so, trying to bring up the laptop to be eye level, is pretty important for posture in the workplace too, for me.
Absolutely. And most employers should, or unless you're self-employed, invest in a stand-up desk, which are a lot cheaper now. I've got one, my laptop's on it right now, and I changed the position. So see how it's, I can elevate it. And then when I've been sitting here too long, I'll change and then just rise up, stand up, and just go with it. Makes a huge difference. I also have to change the kind of seat I'm sitting in. So I'm in a really nice, expensive Herman Miller chair, but I can't sit here for more than an hour. I have to change to the piano bench, or I'll get like a nice chair with a cushion, and then I'll stand up. I'll even get a bar stool. So I change my seated position on the days that I'm working for 6 to 8 to 10 hours on the computer, just varying position.
Yeah.
A little bit about spine anatomy from the lateral view, the side view. This would be the left side. So you're looking this way. This is the back of the spine. Here are 7 cervical vertebrae, 12 thoracic, 5 lumbar, and then 5 fused sacral segments, 5 fused coccyx segments. From the back view, again, straight up and down vertically, you've got C1 through C7, T1 through T12, L1 through L5, and S1 through S5. This is a healthy spine. This is how our body should look. And this is how our body can absorb shock optimally in the discs. Here is the progression of spine disorders. This is what you want, a nice normal disc. On an X-ray or an MRI, that disc should look white. If it shows up black, that means that it's desiccated or dried out. It means immediately that you're not hydrating enough. You are not drinking enough water, and your body needs to have water to get rid of pain. It washes away inflammation. Degenerative disc disease starts really in your childhood years because more, not childhood, I should say more teenage years when you start doing sports. So if boys are playing football, they definitely get pretty advanced degenerative spine disease because of the impact being so heavy at an early age, in your teens or your early 20s. The next level would be then a bulging disc where the disc is compressed so much that the disc material, it's called the nucleus pulposus. If you could kind of think of a jelly donut and squishing the jelly donut, it starts to push out. And a bulging disc is different from a herniated disc in that this is now torn. The outer layers of the disc is a very tough fiber called the annulus fibrosus. They're rings. Now it's busting out, and that nucleus pulposus is completely extruding into the spinal cord and the spinal nerve root canal. So that's why people get paresthesias, numbness, tingling, sharp shooting pain, knee buckling, even myelopathy symptoms, which means that there's motor weakness. After herniations, then your disc is so thin that your bones get closer and closer together. This is level 4 spine disease, where you're creating osteophytes, bone spurs. You can get central canal stenosis or foraminal stenosis. I'll tell you the difference between both of those in a second. You can end up getting a spondylolisthesis, which is not level 4 spine disease. Spondylolisthesis could be level 1, because it could be a level 1 spondy. A level 4 spondy is where it's really shifted forward. I have one, but I don't have chronic back pain anymore. I used to for years, over a decade, which is proof that the spine heals. You can heal your body, right?
That's what I'm hoping for.
Yes, exactly.
Yeah, that's where I am.
Yes. And then you can have, so do you see how these osteophytes here, there's like no hole there. So these holes are super important. The holes are so your spinal cord runs vertically. Then the spinal nerves run laterally out to the left side and to the right side. So if this herniated disc is bulging out on the left side, you're going to have left nerve root compression and left lower extremity symptoms. Makes sense, right?
So does that have to be repaired through surgery?
No.
The herniated?
Nope.
So, okay, so that hole will basically can heal back.
Mm-hmm.
Hey, Veronica, can you go back one for a second?
Yeah.
Okay, so of all these things like degenerative disc, bulging, herniated, can those at least be healed? Can you heal from a herniated disc or a bulging disc, or is it something you're always going to probably have?
You'll always have it, but it will be in less inflammation or no inflammation and no symptoms.
Okay.
So in essence, yes, you can heal from it, meaning when there's a bulge, that can get sucked back in and not even push on this area anymore. But when you have a herniation, this thing can actually hang out, or it'll pinch off and go into your spinal fluid, and your body will metabolize it and it'll go out. It'll actually leave the body.
Can heal?
Yes, this little tear will heal, because as long as you don't keep doing flexion, if you have an extension bias, or vice versa, some people do extension and it's killing them. It feels better to round. It varies from person to person. And I can go even into more detail on whether or not it's a posterior herniation, an anterior herniation, the spondylolisthesis, the stenosis, facet joint compression, all of those different diagnoses that are easily tested face-to-face or on an X-ray and MRI. Then I can prescribe the right exercises to do to offset the damage so that your body can heal faster than it's injuring.
Now, how about a thinning disc? Once it's thin, can it build back material or not?
No.
Okay.
So when you have a thinning disc, this photo does not show it, but that hole gets smaller.
Okay.
That little hole there, when it gets smaller, it's called foraminal stenosis, and your nerves can get pinched or irritated. It's a little bit more vulnerable, and you may have a constant low level amount of ache in your lower back. But if your abs are strong and your multifidi are strong, then you can decompress this thinning disc by 40% and be symptom free.
Okay.
The missing ingredient is core strength, real deep core strength, not like, doing lateral lunges and doing all this stuff like on a surfboard simulation. That's not core strength. Yeah, you have to engage your core, but the core strength, the root cause of core strength is proper transversus abdominis, multifidi, pelvic floor, respiratory diaphragm activation. And that's the bread and butter of what I do and what I teach. Okay. So yeah, it'll heal. And, this will repair, if it's a herniation, that can repair. I did want to mention that sometimes when people go here, I have a 70-year-old client who broke his back in his 30s, and he's got osteophytes. He doesn't have any sciatic pain, no numbness and tingling like he used to, because his spine is auto-fused. If you get surgery, you get a fusion so that your nerves have more room to breathe. But if you age decade after decade, you could actually end up getting auto-fused, like they just fuse on their own. Well, what does a fusion do? It creates
less flexibility, right?
Yes, it creates stability. Now they have an internal stability. Yeah, it increases stability. So now he has stability in his spine, almost as if he had a rod in there, so that he stops damaging his spine by doing excessive motions. So he barely has any symptoms. Every once in a while he gets a little glute irritation, and he loves the dry needling. So I do the needling. But now, he's like hiking and walking and just like feeling great. So it's really bizarre, but you can get autofusion. On the flip side, I've also seen people who have such severe bone spurs and they have very little body awareness, no hydration in their body, no detoxification protocols, and they are in a wheelchair because their legs just don't work anymore. It's almost like a self-paralyzing process.
Okay, thanks. That was helpful.
Yeah, you're welcome. Absolutely. I love the questions.
Those are all my questions too, so thank you.
Oh, good. From a top view, this is your annulus fibrosus, and this inside is the nucleus pulposus. This is your spinal vertebra, transverse process on the left, transverse process on the right, spinous process in the back. So if I poke on your back, this is what I feel. Inside of that canal is your spinal cord and the nerves that go out to the right and to the left. Are you guys visualizing based on what we just saw a second ago? So this is the foraminal stenosis can happen if this is bulging out really bad. Actually, I should say that again. Foraminal stenosis happens more so when the disc is thin and then the bone is closer to the bottom bone. The top bone is close to the bottom bone. But with the herniation, with all that compression over and over and over again, and I had my first baby when I was in my early 20s. I had no problem with my back, but in my later 20s, I like I said, I think it was around 80 pounds I gained with my second baby. It was 80 pounds. So having that increased mass on the front of my body put an excessive strain on my lower back. And I had terrible back pain and terrible sciatica during my second pregnancy. So this is actually, I didn't have a herniation. I had bulges. I thought for sure I had herniations. They were bulges though, because I had MRIs done.
And that was during your pregnancy?
No, after 2004. 2004. Yeah, I got my back pain. I had back pain and sciatica during my pregnancy, but it went away like after I had the baby and I lost the weight. But it really wasn't until 2004 when I think I coughed or sneezed and I was holding that Pilates thing and I felt the shooting pain, like electricity. And that's when I knew I had bulged a disc officially. So that's a compressed nerve root. Oh, and these little things, those are your tracts, your spinal nerve tracts, and they come from the brain. So if you know of somebody who has had a terrible spinal cord injury from a car accident or a traumatic fall, They sever part of their spinal cord where there's pressure on the front or the side or the back. And then those nerves go dead. That's why that causes paralysis, where you either have, quadriplegia if it happens at the neck, or that's quadriplegia at the neck below. But if it happens at the waist below, then you would have, what's it called? Is it hemiplegia? I don't even remember. Quadriplegia, paraplegia, right?
Right. Yeah.
Thank you, Dave. Yes. Paraplegic is when you're waist down paralyzed. Quadriplegic is when you're neck down. Hemiplegic is when you're half body from a stroke. So interestingly enough, I have treated people with severe degenerative disc and spine arthritis to the point where they have ignored all the numbness and the tingling and the foot drop and the knee buckling for years, to the point of even getting bowel and bladder dysfunction. They lose their ability to even know that they're going to the bathroom. So it's called incontinence. It's neurogenic incontinence. And then I read their films, and lo and behold, they've got 25% ventral, which means front, thecal sac, which means the front part of your spinal cord, compression. And so they're actually inducing a slow version of a spinal cord injury. And I call those patients spinal myelopathy. They have myelopathy syndrome. And then, I just say, you've got to see a neurologist ASAP. We've got to figure out whether or not you're a surgical candidate to get the pressure of the bone spurs or the pressure of your discs off of your cord. There's a lot of space between the disc and the cord. So you've got to be pretty traumatically injured or have a pretty low body awareness to get to the point where you're compressing your spinal cord.
Mm-hmm.
It'll even say spinal cord is deformed. And they'll just be like, yeah, but I only have foot drop. I'm not paralyzed. I'm not a quadriplegic or a paraplegic. Doesn't matter. It can cause permanent nerve damage. This guy is my favorite graphic. Derm means skin, tome means cut, radiculopathy means that you have a bulging disc and you have nerve compression. Doesn't mean that it has to be painful. So this infographic is called the Dermatome Man. Derm means skin, tome means cut. And you can have symptoms from your bulging discs or pinched nerves that don't have to be painful. They can be numb, tingly, tooth achy, cramping, Charlie horse, manifesting as weakness, buckling, or loss of balance. So if you look at the distribution of L1, L2, L3, L4, L5, S1, you'll see that all of this correlates to where your pinched nerve is. So if you have chronic sciatica, then you would have L5, S1, herniation or a disc bulge with nerve compression. If you have knee buckling, which I've experienced in my right knee, then you have an L3, L4 bulge that's really inflamed and it's pushing that nerve quite a bit, or even pushing into the cord. So you could have pinky toe pain, and that would just be S1. Soles of your feet are L5. So if you look at the map of the Dermatome Man, you can correlate it to where the injury is in the spinal column. That's why spine stabilization exercises is the most important foundation for anyone who wants to be active.
That is pretty cool chart.
Yeah, it is cool.
Yeah. Myotome, this is when it starts to get a little bit more serious. Like I mentioned, the spinal myelopathy for one of the patients that I had. He didn't have very good body awareness of the injuries that he had sustained, and had that impulsive personality where he just did a bunch of stuff. He was a daredevil. So he experienced drop foot, pelvic floor weakness, where he was incontinent, really weak abdominal core. And then other patients of mine have had difficulty. I had a patient who couldn't pick up a coffee cup anymore. He was an auto mechanic, and all he did was mask the pain for 20 years by taking ibuprofen every day. Mm-hmm. He masked the pain, so his body was not signaling that he was getting so much damage to his cervical spine that he ended up having upper extremity myelopathy. He had no motor function anymore, and he was in his 40s. So by the time I saw him, I said, you must see this neurologist in Annapolis to assess you. And sure enough, he was a prime candidate for neurological surgery. to get the pressure off of his cord. And it took him about a year to rehabilitate. He did have an infection, which can happen when you have surgery, but his life is back. He's able to have that motor control back. Myelopathy can happen with severe arthritis, severe spine, nerve root, or cord compression. It can be the cause of this weakness, motor control. So you can see lifting your foot up is L4, L5, pointing your toes down is S1, S2. This is a bad graphic. It's kind of fuzzy because of Zoom. So I'll upload the handout inside of the course portal. But it also shows you everything here on what it does. Differential diagnosis means you nail the diagnosis, not, oh, you've got IT band syndrome, or, oh, you have plantar fasciitis, or, oh, you just got elbow tendonitis. It could be if you're repetitively stressing those things or you had an injury, but you want to nail the diagnosis by understanding exactly what it is and how it got there. Differential diagnosis can be done by a PT examination by doing special tests. We did the functional movement assessment. That FMA helps you to identify what turns on your symptoms and what turns off the symptoms and what exercises you should focus on until your spine heals. Then slowly reintroduce some of the exercises back in once your spine is healed, or you may have to omit them forever. My omission of an exercise has been back bends. Just because I can do a back bend, because I was a gymnast, doesn't mean I should do it in a yoga class. I did a back bend when my back was feeling healthy, and I flared up all my symptoms again. So my differential diagnosis was an anterolisthesis in my spine, meaning hyperextension excessively is not going to serve me. If you know what your differential diagnosis is, that's how you're going to heal. You will not heal from repeated injections, oral medications, repeated massages. That helps tremendously, but it doesn't get to the root cause. We want to know the origin. Here's some spine videos. Again, I'll have to put these in the portal, but they show you like interactively, like you'll click on the little disc bulge and you'll see it radiating down into the leg. Tells you the difference between a herniated disc, sensory, and muscle weakness. Okay, so what do I do? Core. If you have an acute flare-up, stop everything. Stabilize your spine, wear a back brace, lie on your back, don't go to work. You need to recover. If you push through it by taking medication and you just go do the things that you're normally doing, you're going to prolong the healing. Change your bed, change your furniture, create an ergonomically correct workstation, buy a new office chair, use pillows, wedges, or props. I wrote Veridesk. This was written a long time ago. I don't even know if that still exists.
I have one. I actually have a true Veridesk at work.
Awesome.
It's great.
That's
I mean,
great.
those things cost a lot of money, but I didn't pay for it. But it's helped me show with that scanning. Yeah.
Yes, yes. Vital. It's going to help keep your employees healthy. These are all preventive strategies. And then, with genetics and scoliosis, it's going to be surgery as a very last resort. And you want to exhaust out all of your conservative methods first. Physical therapy, massage therapy, acupuncture, chiropractic, anything that's going to help relieve your symptoms to help you function better. So, okay. So the phases of healing: acute, subacute, chronic, and wellness. Acute is you just threw out your back or you just got a flare up. That's when you are supposed to completely stop everything. Don't go for a walk. It's not going to make you feel better. Get off your feet, lie down on your back, prop your legs up, ice it, take medications. That's fine in those first 3 days. You're not designed to take medication really beyond that first week. And I'm talking like muscle relaxants, addictive opioids. All those things are not really meant for your body to be on long-term. They should only be used for the acute phase. Subacute, you're weaning your heavy meds. You begin level 1 core stability training. Don't go back to your level 2, 3 core workouts. You're gently going back into bracing, because during an acute injury, everything shuts off. Your abs are not going to work properly. Your back muscles are not going to work properly. So you don't even want to exercise You just want to rest and do inflammation control. And then here you add stuff in. Then if you've had chronic low-level back pain or low-level radiculopathy, just focus on, whenever you're exercising, focus on strengthening your postural muscles, focus on doing your prescribed spine exercises, and then try to completely get rid of all meds. And then when you're in the wellness prevention stage, you're just independent managing. You have to do a routine. And if you don't do a routine, things are going to get weak. And then all of a sudden you throw out your back, you feel like, oh my gosh, I've totally neglected myself. I've been eating highly inflammatory foods. I've gained 5 pounds and I'm not doing core exercises. So you just want to make it a habit. Okay. This is acute care medicine, nerve blocks, et cetera, et cetera. PT intervention would be functional manual therapy, where you're digging into those trigger points of your glute max, glute medius, piriformis, psoas, quadratus lumborum, all those areas that tend to get really tight. And by the way, I forgot to tell you that I love the analogy of taking a water hose, watering flowers. If you kink the hose, the water is going to come out in spurts. If you unkink it, the water is going to flow freely to those flowers and the flowers will thrive. Well, your spine is the hose, the water is the nerve conduction velocity, and the flowers are your muscles. So anytime you kink the hose or you kink your nerve or you pinch it, you're going to get altered nerve signaling to your muscles, and then your muscles will spasm. They will tighten up and they will stay tight until somebody digs their thumb in there or releases it with a dry needle or something like that, right? Stretching does help, but it usually has to be reset. So think of that. Neuro-re-ed is just the spine stabilization. Therapeutic exercises is restoring your mobility and stretching, strengthening and building your endurance. Therapeutic activities is addressing your sleep posture, your body mechanics, getting a back brace when you have a flare-up. I mean, I've got a couple back braces, thank God for them, because if I have a flare-up, I just stick that thing on and it makes life so much better. Having a home exercise program and then a long-term wellness plan is going to set you up for success. Walk daily. Our bodies were designed to walk. Only do it if you're not getting provocation of symptoms. Squatting, this is a functional squat. She's got neutral spine. Some people feel better with a slight arch there. She particularly felt good with a really flat back with her tailbone tucked, and she's a CrossFitter. Lifting mechanics. This is the golfer's lift, and this is just using a half kneel where you're picking up something heavy, but the key is to maintain neutral spine at all times. Sleeping position, pillow under the head, pillow under the thighs. She preferred multiple pillows to take the pressure off her lumbar spine. He had a really thick bolster under his head just to get neutral spine from head to tailbone. Yoga bolster between the knees, yoga bolster under the head, and a hug pillow just to align the shoulder so there was less strain on the neck. Spine. I don't know why I have spine sitting. That was an accident. But change your position when you're at work. Get your ergonomic workstation. There's the little Very desk. Functional squats. So here's some recommendations. These are based on the American College of Sports Medicine. You want cardio 150 minutes a week. That's a big, tall order, but my recommendation is 20 minutes of walking per day. And then you can increase your cardio as long as it doesn't cause provocation of symptoms. Walking outside is more ideal because you're going to get the fresh air, the sunshine, you can clear your mind. It's more of a holistic form of cardio exercise. But if you prefer going to the gym or going into your basement or whatever, using your treadmill, something is better than nothing. It really helps with circulation and it helps your muscles and tissues to all, just increases ATP, energy production, increases mitochondria. Resistance, twice a week. 3 times maybe, but if you have any spine issues, twice a week is plenty. Flexibility, twice a week. Neuromotor, that's Pilates and yoga. Spine stabilization, 2 to 3 times a week, but you can do more with that. And then I just go into more detail about each of these, but because it takes a little while to go through this, it's already 12:53. I'm just going to kind of cruise through these. I wanted to show you a picture of the transversus abdominis. your abdominal wall has 4 layers of muscles. The first and most superficial layer is the rectus abdominis. This is where your 6-pack, 8-pack abs would be. The second layer is this external oblique. Looks like on here it's the first layer, but actually it's underneath. The external abdominal oblique. The third one is the internal oblique. And the fourth and deepest one is this transversus abdominis. It's horizontal across the belly, like a cummerbund. It's been estimated that when you contract the transversus abdominis and other muscles, it reduces vertical pressure on your discs by as much as 40%. Failure to engage your transversus abdominis during high intensity lifts is dangerous and it causes injury to the spine. The transversus abdominis acts as a girdle or an internal corset by creating hoop tension. This research study was done in 1997 by doctors Hodges and Richardson. And there's a lot of studies since then that have proven that when you strengthen your internal corset muscles, you will take pressure off of your discs, almost half by half. These are the multifidi, the muscles I'm always mentioning when I'm guiding you through spine exercises. When you tuck and brace, either at your neck or your lower back, these muscles turn on. Generally, they don't turn on, and generally they're weak in every single person I check with my hands on. They're very deep. They're way below the erector spinae group. The erector spinae group goes on top of that. Those are the superficial muscles. Pelvic floor. There are tons of muscles in the pelvic floor. It's not just like one muscle group called the Kegels. Levator, ani, pubococcygeus, puborectalis, iliococcygeus, and connective tissue. So you want to have a strong pelvic floor, not overly strong where you're gripping and causing perineal pain, but just enough to be able to control the flow of urine, to control and engage while you're doing your abdominal work. And then the last is your respiratory diaphragm. The parachute. Look at how it's shaped. When you inhale, the diaphragm contracts and descends. That's why your belly rises. As you exhale, the fibers elongate and they go right back up into the chest cavity, and that's why your belly falls. Longus colli and longus capitis are in your neck. Those are your deep neck flexors that engage when you do that chin tuck. You don't want to look down. You look straight forward. Your ears are forward. You pull your head back and your ears are aligned above your shoulders. This reduces compression in your cervical discs. Here's an example of all the spine core exercises. You can use the foam roller, biofeedback cuff. TRX is for super advanced back education training, gyrotonics, if you've ever heard of that, Feldenkrais, there's tons of stuff. In medical therapeutic yoga training, I learned about this pentagon of wellness. It's addressing not only the physical, but the emotional, intellectual, spiritual, and energetic. So that's why we address nutrition and hydration, meditation, stress reduction, the spiritual aspect. Just for me, I've experienced that. Like, what is God trying to tell me? Maybe I need to slow down. I'm just doing way too much. If anyone else has experienced that before.
Yeah.
So don't subsidize your illness, invest in your wellness, focus on posture and spine specific exercises. The health of your spine and your overall posture is very serious. It's proper healing. It's not quick. It's kind of slower medicine, but you can do it in 30 days. There's some research, some books, and some recommendations. At the time, I've got to update some things, but I had the Tufted Needle, American Made, some of the foam ones, the brace, yoga mats, blankets, all that stuff. So I'll have that. Here's my references. And then I teach classes, medical therapeutic yoga every Tuesday at 10:30, Pilates every Tuesday, Thursday at 9 a.m. The Thursday class is more of a hybrid of medical yoga and Pilates, but it's just to maintain wellness in your body and just showing up and doing it if you don't do it on your own, and also for being a part of the community and, just coming in. So